My name is Aaron Gertz, and I'm the editor-in-chief of ASH Clinical News. I'm here today with Dr. Hind to discuss her exciting abstract that was presented here at the annual meeting. Certainly an abstract that I really enjoyed reading. Within the CHIP world here, and myeloid neoplasia is kind of what I do. So I really did enjoy the work. My first question is really about kind of CHIP globally. We've associated CHIP with other outcomes like heart disease, and the directionality seems to go the other way.
Yeah.
So in Alzheimer's disease and the connection between CHIP and Alzheimer's disease, which directionality was it go? Was it adverse or a favorable prognostic factor for those diseases?
So regarding Alzheimer's disease, it was protective against Alzheimer's disease. So carrying CHIP is protective against Alzheimer's disease. So we showed it in two independent cohorts and a case control study where we found that CHIP carriers had a lower risk of having Alzheimer's dementia. We also looked at brain autopsy data from cognitively intact individuals, and those who carried CHIP mutations had a lower burden of amyloid plaques and tau tangles.
That is just absolutely fascinating. And it's amazing that you were actually getting autopsy samples in this day and age. I know autopsies are very rare nowadays. The types of mutations you're seeing, were they the same mutations that you see in the blood in the brain tissues, or were they different mutations?
So it's basically the same mutations that we saw in the blood of those individuals carrying CHIP. We had actually 8 individuals carrying CHIP mutations. We had data from their blood. We know which mutation they had in the blood, and we looked at those mutations in their brain in both myeloid and neuronal populations so that we were able to sort out. And we found the same mutations in the myeloid population, but we did not find them in the neuronal population.
Were they like the same proportions as well, or was the clonality different of what you saw in the brain versus the blood?
So actually, when we looked into the myeloid population, we looked at those cells carrying those mutations were highly enriched and were representing a large fraction of the microglial pool. Yeah.
That's amazing. I guess my next question would be, why do you think is there any postulation of why this might be protective against Alzheimer's disease?
So that is what we don't know yet. Yeah. We need to study the mechanism to understand how these mutations are protective against Alzheimer's disease. Where we are exploring different hypotheses right now. We might think that CHIP mutations could increase the infiltration of bone marrow-derived cells into the brain, or maybe influence their ability to phagocytose the amyloid plaques, maybe.
Okay.
So it can be different mechanisms. We don't know yet which one is it. Yeah.
That's really interesting. Nobody knows the answer, but do you think there could be other positive relationships between CHIP and other diseases? So you mentioned the phagocytosis and kind of the sucking up of the amyloid plaques. Do you think like other diseases that are plaque driven, do you think potentially they could be ameliorated by CHIP?
It might be, yeah. We don't have any data about this right now,
course,
but many other associations can be explored in the future for sure.
Do you think how can we learn more about this? Because if we had a way of harnessing CHIP to treat Alzheimer's disease, that would be amazing. It's clearly a clinical need. What do you think is the next logical step to get towards that goal?
Well, I think now the most important is understand the mechanism by which CHIP protects against AD. If we can understand that, we would be able to imagine new therapeutic interventions where we can use molecules that would mimic what CHIP mutations do in modulating the immune cells.
Well, that's fantastic. Any other kind of points you'd like to bring up about your abstract?
Well, just that it's super exciting.
I couldn't agree more.
We were surprised, as you mentioned, by this association at the beginning, but we confirmed it in so many cohorts. Now we are just so excited and looking forward to understand how CHIP protects against AD.
You are definitely not the only one that was excited. I actually had to read your abstract twice. Like, wait, there's a positive association there and not negative? That's amazing.
Yeah, right.
So wonderful work. I congratulate you on this.
Thank you.
And a wonderful presentation at the annual meeting here. And thank you so much for your attention. If you'd like to read the abstract, it is in the blood journals as well as our coverage via ASH Clinical News. Again, Dr. Hind, thank you so much for joining me today.
Thank you for having me.
Thanks.